Hi, welcome to helpyourmath.com. Today you're going to see that we have two very special guests, and together we're going to talk about the metric conversion for nursing. So let's think about why this is so important in the field of nursing in particular. Okay, what do we use metric measurements for? Well, in nursing, the most typical use of a metric measurement is for a medication dosage. So first of all, what different types of medications are there? Well, there are oral medications, which are typically in the form of some sort of tablet or a liquid. We have cough syrups. Now, cough syrups are liquids, so they would be measured in the same way as any other liquid medication in most cases. Then you have injections. These are your shots, and these could be intramuscular or subcutaneous. And finally, you have your intravenous drugs. So intravenous drugs are typically drugs that need to be given over a certain time period, and they're usually given in a hospital setting. So what can go wrong with these medication dosages? Well, first of all, most dosages are calculated based on somebody's weight. So if we're using pounds in one place to represent somebody's weight, but kilograms in another, and we incorrectly convert, then somebody could be not given enough medication, or maybe they're given too much and they're overdosed. Another problem is that someone's dosage can be incorrectly calculated because of a simple conversion error. This could happen just if you're taking the same medication, but you're moving from a tablet to a liquid. And finally, someone could be told to take 1,000 milligrams instead of 1,000 micrograms, or vice versa. So just to give you some idea as to what this means, 1 milligram is equal to 1,000 micrograms. So if you're supposed to take 1,000 micrograms, then you're only supposed to take a single milligram. If you're told to take 1,000 milligrams instead, you have just been overdosed 1,000 times the amount that you were supposed to be. So milligrams and micrograms are very different, and it's really important that not only are the numbers correct, but the units are also correct. Okay, so those are the things that can go wrong. So why would we want to use the metric system? Well, there are a few reasons. The first thing is that we want to decrease clerical errors. So we want some sort of consistency, and if we're using two different systems, then that becomes a problem. So imagine if a nurse is recording the weight of the patient. This prevents the need to record, is that weight in kilograms or in pounds? And that could lead to the clerical error that we were talking about before. The metric system in particular is used because conversions are much easier. So conversions in the metric system are based on a power of 10. To get from one unit to another, we're either multiplying by 10, by 100, by 1,000, or we're dividing by 10, 100, or 1,000. Whereas in other systems, it might be a little bit different. So think about your height, okay? If we record your height, in the US, we record it in terms of feet and inches. So if somebody is 6 feet and we want to determine how many inches they are, we need to multiply by 12, okay? And the same problem can come in when you're converting from feet to yards. There are 3 feet in a yard. There are 5,280 feet in a mile. These are things that you have to memorize, right? And these numbers are not simple to remember. So the conversions in the metric system are much less complicated than in other systems that we use. One consistent system also prevents the need for these conversions. So if you go to a doctor's office, one of the first questions that you're asked is what medication you're on and what is the dosage. If you go to a doctor and you're giving the dosage in one unit and the second doctor is calculating the dosage in a different unit, then there has to be some conversion either by you or by the doctor. And this could lead to errors. So what we're trying to do is we're trying to prevent medication dosaging errors. And this is one way to do that. And just as important, This is the way it works worldwide. So it's not just going from one doctor to another within the United States, but if you go on vacation and you break your ankle in Italy and you need to get treated, again, they're going to ask you, what medications are you on? What is the dosage? And for the same reason, you don't want to convert. So this is really important that it's a worldwide system. So what happens if we get it wrong? What's the trouble? Why is this so important? Because if something goes wrong, somebody is being harmed or somebody potentially is dying. Okay, let's not get so extreme. Let's think about some of the more minor symptoms, particularly if you were overdosed. So it could be something as simple as abdominal pain, nausea, or vomiting, which is very uncomfortable, but okay, you'll survive, you'll recover. You can be lethargic or very tired, or in more serious cases, you could fall into a coma. There could be changes in pulse, respiration, or blood pressure, your vital signs, and it may not be serious, or it may potentially become extremely serious. A more serious symptom could be paralysis. You could also experience heart or lung damage or damage to another organ. And sometimes you recover, sometimes you may not. Sometimes that damage is permanent. And finally, in some cases, they might be rare, but in some cases, you'll die. Okay, so clearly a medication dosage can critically harm a patient. But remember, as a nurse, you're harmed as well, because if it's your mistake, then you're also suffering the consequences. So the metric system, again, is critically important. So as you go through this and you're doing the conversions, keep that in mind. Every time that you do a conversion, how careful you need to be so that mistakes are not made.